Liposuction is generally just a really good procedure for people. If you can get to patients earlier, they get better results because you can just remove the fat and their skin will tighten. So on young patients, sometimes men and women, that are even 20 or 25, they have like a good amount of fat under their neck because it's just genetic. That's where they have more fat cells. So if you can target those areas, they'll get a great result with that and it'll solve their problem forever, which is nice. Other areas you can treat, sometimes you'll see women and even men with extra breast tissue or extra fatty tissue in the breast or under the breast or the side of the breast. So liposuction really works well there. Even in some of my younger patients that need breast reductions, like patients who are 19 or 20, a lot of the women that you don't really want to do an invasive breast reduction on because of scarring and issues with possible breastfeeding and that. Sometimes we'll just do a reduction of any fatty tissue if there's enough fatty tissue, and you might knock them down 3/4 of a cup size or a cup size, and then you just tell them, this is going to give you a good start, and then once your family's set potentially, maybe we can do something more invasive if needed for a breast reduction, a formal breast reduction. So I find it useful kind of face, breast area, abdomen, really almost any part of the body, arms, inner thighs, like it's just a really good adjunct, even knees, as much as you'd think that's silly, but if someone's leg's perfect and they have like fatty knee areas, it kind of makes the knees not look as elongated as they'd like. So just targeting that small area, it makes a big difference because, people get bothered by all sorts of things. You don't have to trivialize it, but if you can help them, I think a liposuction kind of is a great equalizer. It just equalizes genetic problems that people are born with.